There are over 560 federally recognized tribes across the United States. And when I was the director of Indian Health Service, I would work with all of them in the different states where we had hospitals and clinics. And I would have tribal leaders tell me over and over and over that when you have met one tribe, or when you have seen one tribe, you have met one tribe and seen one tribe. We're all a little different. And that's what the American Cancer Society is doing right now, with this focus on indigenous populations. They have said, we know one size does not fit all. And we are going to take a special look at these populations and drill down and find out what we can do to better serve their needs. The Chickasaw Nation Reservation includes all or part of 13 counties in south central Oklahoma. Chickasaw citizens make up about 82,000 people. What we're looking for in the Chickasaw Nation from a healthcare perspective is equitable access to all levels of care for our population, and specifically around cancer treatment.
So when it comes to the Chickasaw Nation, bottom line, we want to decrease morbidity and mortality. And those numbers are not on par with the general population. And that's ultimately the definition of health inequity.
One of the primary challenges that we have is our wide geographical area. Our patients may live significantly far from where they need to go.
About 90 miles, an hour and a half, one way to do my treatment.
Definitely being in rural Oklahoma, traveling is a huge burden to a lot of our patients.
The Chickasaw Nation and almost all tribes are rural, some very, very rural in nature. So we're really talking also rural issues with healthcare as much or more than tribal issues.
The urban areas have access to healthcare that we don't in rural America. The best healthcare that isn't here. We have to go a long ways to get it.
The fact that my dad didn't get screening and didn't find out he had cancer till he was stage 4 is a lot of the reason why he's not with us today. He's from a rural community in Alaska, so he got the treatment he needed when he could get to it, but if he can't get to Anchorage, he's not going to get the treatment he needs.
For us, you're flying in, flying out, and if you look at just the expense of doing something like that, you can see where something like screening might take a low priority.
If you have to fly in to get a colonoscopy, you and somebody has to come with you to take you home afterward. There's only a couple flights a week to your community, and you need to stay overnight to do your bowel prep ahead of time. And then the weather's bad, so it might be a week that you're away from home. And so all of that, I think, can be really challenging for people to access care.
Growing up in rural Hawaii, that's a big conversation, because oftentimes the person struggling will think that they are too big of a burden, or their disease is too big of a burden on the family structure. How much sacrifice is it going to require of my family for me to do this?
It may become so burdensome that they decide to discontinue treatment and care to the point where they succumb to cancer.
This young man, he was my age, and he came to see me and said, I have to give up. I can't make my cancer treatment. Because he said added stress wasn't helping him to worry about, one, how am I going to get there, and two, how am I going to cover the gas to get home once I get there. And so he quit and he succumbed to cancer.
The biggest fight of their life, and they've got to fight to see the doctor. So health equity, I don't think we're there yet. We shouldn't have to fight to survive.
Here in Hawaii, we can't just drive to the hospital. We need to catch a plane and go to the hospital and find a hotel room, and not everybody can afford that. And I'll always be grateful for American Cancer Society because everyone's journey with cancer is a little bit different. And American Cancer is really great because they can look at everyone's personal journey and recommend ways that they can help and different resources. Like there's Hope Lodge to help people who need housing.
It's so appropriately named. It's hopeful. Every minute you're there, you feel like ohana, you feel like family. Malama, they take care.
It's almost like they don't allow you to have any negative feelings, and there's no opportunity for it.
Hope Lodge is home away from home for me. For each surgery, I stayed there 3 weeks.
I was actually scared to stay with a whole bunch of other cancer patients, but they became like family.
At Hope Lodge, I felt empowered by the people that I met.
After maybe the second night, I was like, I don't want to go home.
I'm thankful for Hope Lodge.
American Cancer Society Hope Lodge helps us heal right down to the bone.
American Cancer Society, please continue. Please continue what you do for people like me.
Mahalo meke aloha la. Mahalo ke akua.
When you're hearing the music, you are receiving it and also releasing things that need to be released and then absorbing positive energy. Think of the music that way because it rejuvenates you. Loloma ne bahusompe yan namatsewa pa namangkangak sino pa na esonwa pa e kiamai etana pa mai nawawangwa sangopangakang. So these are I call them my brothers. My little brothers, and sometimes they get upset because I don't take them out as much as I should to have them share their stories. The music is not rehearsed, so it's always kind of indicative of like the emotions, things that are happening at the current time. And so it's really a powerful thing, and you can address historical trauma with this. When we talk about historical trauma, the legacy of colonization has really situated indigenous peoples as people of the past, right, as not important or as people who are eventually no longer going to exist. And it has elevated into a lot of the red tape, the bureaucracy, everything that is embedded in these systems that we see today around indigenous people. Everything is institutionalized, our education systems, our healthcare models. And that is a very real circumstance, difficult circumstance that informs a lot of these health inequities where we're basically overrepresented when we talk about forms of cancer.
I've worked in Indian health for 38 years, and I have seen some progress, but not as much as you should see in 4 decades.
The reality is that we're not there yet. So there's a lot of reasons of why that's the case. With the Chickasaw Nation, as with many indigenous communities, there's a lot of historical trauma. Being aware of that and going back to things like trust. Who do you trust?
When you're hearing the stories of distrust, you're hearing stories of pain, you're hearing stories of historical trauma, those stories have been othered or made invisible. One example that really illuminates the story of distrust and fear among indigenous people is between 1973 and 1976, uninformed, without consent, women were being sterilized. Upon learning about this, you can imagine the anger and the distrust that created by our indigenous communities.
How are you going to trust someone who potentially has deceived you in the past? So whether it's on the individual level or whether it's on a population level, tribal level, community level, knowing that, acknowledging that, that's going to be one of those first steps to get us to hopefully one day making that health inequity disappear.
between boarding schools, with being moved onto reservations. You have that history that has directly impacted the Native population and our ability to hold on to our culture. It's unfortunate when you look at boarding schools and how many people were forced to not speak their language and how repressed that language became in some of those people.
How we lived through the boarding school era of BIA is different families, the elders would get together and they would keep one child out. They would hide them from the BIA, and the elders would bring that child up and mold them, and that child would become a longhouse leader because they retained the language, they retained the songs, the legends, the stories. I think it's important for all Native and Indigenous people, no matter how remote we live, to keep our ways alive.
It's significant because we are survivors. We have always been here. This country was built on Native land.
As we think about cancer prevention or cancer health, that interaction and engagement with forced colonization practices, those all inform levels of inequity that exist among Indigenous communities.
I feel like it's more systematic barriers that we were placed in. The government put us in systems that would give us those inequalities of healthcare.
In Indian country, we're groomed from very young for a life of hardship.
I'm Elena Nanagas. I moved to the Umatilla Indian Reservation at about 21 years old. I identify as Umatilla and Cayuse. We date back 10,000 years that can be proven. We're all very proud where our people come from. And the land gave us everything we needed. The land is our survival. We're salmon people, and we made a promise. We promised the fish, and we promised the deer, the elk, we promised the plants, all our roots, that if they took care of us, we would take care of them. I'm most comfortable when I'm on my homelands, when I'm surrounded by the culture in my life, the people. I feel the energy. It's a beautiful place, but there's those limitations to the beautiful conversations and times that you share with people, gathering your foods, talking about the day, preparing your foods, serving them to your family. That's all a beautiful thing, and what a lovely story. Until you start figuring out what's in your food. My grandmother ended up getting cancer at a fairly young age, and she talked a lot about downwinders. She talked a lot about being just in the environment around the Hanford Nuclear Reservation. It was just a few miles upriver from where we lived. And she was sure many of her friends and herself got cancer from the pollution that was generated from Hanford and creating atomic bombs.
From that story, think about the lack of education and awareness by local community members about the impact uranium tailings could have on the local community. When we talk about these environmental conditions that exist in Indigenous communities, they exist far and wide, not only through uranium tailings, but also, like access to quality foods. When we look at these factors or indicators that inform quality of life outcomes, they call that the social determinants of health.
When you talk about some of those social determinants of health, as time has gone on, we have learned that the delivery of culturally appropriate care is very important.
SDOH is a very westernized paradigm. If we take that framework and we say, well, now let's apply it to any Indigenous community and ask the question, what's missing? Then your responses would include things like land, ceremony, language, traditions, history, generally culture, that's missing.
You look at our values. It's about family. It's about working hard. It's about subsistence, the land. It's about laughter. It's about sharing stories and knowing your people and your language. It's all these things that make us who we are.
A lot of times we just overlook it, or maybe we just refer to it as a passing term, maybe even a buzzword. But culture means so much. So being aware of that is ultimately important in addressing things like health inequities.
Sometimes we feel like we have to conform, right, to get to the places that we want to get to. And that's the frustrating piece. That conformity is debilitating for Indigenous communities.
There are some differences, and there aren't generalizations that can be applied to every single community, every single population. And that's one of the things that the American Cancer Society has done very well. I think they've done really well on acknowledging that there needs to be different strategies.
You know, I really do appreciate the role of the American Cancer Society with sponsoring research projects that support bringing Indigenous communities together to address and identify what these needs are. The American Cancer Society is funding the Center for Native American Cancer Health Equity, a hub for us to bring community partners and have them be involved in this research process to say, this is what we want. Really, they're taking a backseat approach and allowing those from the community to do the work that they need to do. That's Indigenous knowledge.
If you don't recognize that there are cultural differences in healthcare, then there won't be health equity.
It's about human dignity. We can't prejudge people. We have to meet them where they're at.
We need to see people for who they are, right? For Native communities and Indigenous communities, it's important when folks like myself who live in this intersection of so many things, that we come as we are with all of it.
There needs to be an education of ourselves as healthcare providers.
We all have different cultural beliefs. We have different cultural issues that both make us feel better and sometimes are offensive to us. And if you get too many of the bad side of things in a health facility where they're not really addressing you culturally, people just quit going.
A lot of times in the Western world, it's all about the paperwork, where it becomes very impersonal. It's never about making pilina. Pilina is connection.
It's in those connections that we build trust.
That's probably the most difficult hurdle to get through. Having someone to go to, someone you can trust, is really important.
I want to know you. I want to know that you're a good human. I want to know that you care about me, that you care about my family. Oftentimes, the diploma, or the palapala as we call it here, hanging on the wall with your credentials, it can be meaningless. Yes, you're qualified, but who are you?
You can come with all that you think you know, but people don't care how much you know until they know how much you care.
For us, on a little island in the middle of the Pacific Ocean, that can be difficult because a lot of our specialists, they fly in, they provide a consult, and they fly out.
We should be very culturally sensitive to the people that we are serving, because in order to get those that we really need to help, we need to make that connection to want to ma'alama and take care of themselves.
If we don't stand up, if we don't ku'e, then who's gonna do it? And you know what we say in Hawaii? E ku'e kanaka. Stand strong, stand up, stand strong.
I am who I am, and I'll stand firm with my sister here. That together we make it. So not one by one, together we're strong. And loving each other in the true spirit of aloha.
Aloha is an essence. It's a spirit. When we greet each other and you say aloha, there's no words that need to be exchanged other than that. I know you, you know me, and our spirits are together.
Being humble is also very important, that I don't know everything. I don't know about people's lives, so I need to just sit and listen. And sometimes that means my job is just serve tea to elders and sit there and hear about the old stories. And I think that that's important, and that creates those connections and then can lead to more of the cancer screening and cancer prevention ultimately.
An important piece of this conversation is to have doctors who look like us, who understand us, who know us.
For our population and many other indigenous populations, oftentimes you don't see people that look like you. But if you see someone who looks like you and they understand your culture, your history, and things like that, I mean, just imagine how much better that care would be when you have that deep level of understanding.
They can see the songs, they can see the language, they can see others like them to say, I belong.
Within the state of Oklahoma, there are now predominantly Native American medical schools. Totally unheard of. Several years ago, now we have classes that are being graduated every single year that are producing in upwards of 50 to 60 Native American physicians who are then ready to go into specialty training programs like we do have here at Chickasaw Nation Medical Center. The fact that there is a residency program now that Chickasaw Nation has to create physicians to take care of their own, I think is an incredible achievement that kind of continues, that is growing. So I think that is one of the biggest successes that we haven't necessarily seen the real impact of yet, but it is surely coming.
I think that's where we're ahead of the game. We have a distinct population. We have these local hospitals and clinics. We do understand the cultural issues, and the people that we see are moms and dads and brothers and uncles and cousins of the people that work in our clinics.
Your family, and just being able to recognize people and being able to help guide them is a blessing. You don't see that everywhere. So the Chickasaw Nation really embraces the culture. I am a registered nurse case manager / breast care navigator. And so I think that being a case manager and also having the experience of fighting my own journey, I think is, I would say, I don't want to say benefit because nobody wants to have cancer, but I would say it's a blessing to be able to recognize where those people are at their lowest. Cancer doesn't discriminate. I didn't have a family history of breast cancer, and all my genetic testings was negative for that. So I was a 1% out of the whole entire population. So when you look at that, it can happen to anybody. 27, stage 4, triple positive breast cancer. So my cancer fed off of estrogen progesterone, and it had the special HER2 protein. I had a 2-year-old and a 4-year-old and a loving husband. I didn't have a choice but to fight. When you're diagnosed, it just shakes you to your core.
I don't understand why. If breast cancer doesn't run in my family, how could I have gotten this? Why? So in order to beat it, you have to find that strength deep down. You don't realize how strong you are, and that's where the warrior part comes out.
You know you're in for a fight for your life. I didn't have no bills. Can you imagine that? And I thank my tribe for that, for being able to give us those kind of resources and to say, get better. Sadly, some probably lose their battle because they don't have the resources that we have.
There is research that shows, that a person's socioeconomic status is related to better health.
Some of the most gratifying moments are the moments that a patient has contacted me and say, I don't know what to do. I've received a bill in the mail for this service. I don't know how I'm going to be able to afford that. And we're able to contact them back and say, hey, we're able to offer you financial support.
They don't want their citizens being stressed out financially when they're fighting for their life.
The relief, there's tears, sometimes there's laughter. There is an overwhelming sense of appreciation that I no longer have to worry about this financial cost. Metasaw's got this covered. Not only are they receiving life-saving care, but they're receiving the financial assistance that they need to continue to provide for their family.
There's a large focus on families in many, many First American communities. First American families are close-knit. They often live near each other, sometimes for their entire lives.
It's very common to have 3 generations under one roof. When you're living with your grandparents and your parents, you mold together in those 3 generations.
And so when someone gets cancer in the family, it affects the whole family. And the whole family often helps to provide support, but it's also traumatic to the whole family to have to deal with something like that and see the individual go through it.
It's an emotional roller coaster. And there are times where I feel like I'm a burden on my family.
It's not easy. It's hard. It's easy to give up. It's harder to stay strong and fight.
Cancer is not a sprint. It is a long-term race. So we're trying to do everything we can these days to provide that sort of health care that gives our people a fighting chance, so that people like Brittany and Jenny have a fighting chance. American Cancer Society has done so much to provide a framework for the types of programs and services that we provide our patients.
Without the American Cancer Society, we wouldn't have our guidelines for colonoscopies. We wouldn't have our guidelines for mammography and what that looks like for screenings and being able to detect it early. As we know, the earlier it is, the easier it is to treat it. The later stages, those are the ones that shake you to your core.
Our elder population here, they may not come as regular as we would like them to, and so we don't get a diagnosis as early as we'd like.
People wait too long, the individuals themselves. I can't blame the medical system. And then early treatment is critical, and that's just not happening. So when you wait too long, we're going to lose a person.
Although we have a low incidence rate, we have a higher mortality, and that's because we're not catching cancer soon enough.
Oftentimes we're caught in a place where we're really talking less about prevention, intervention, and more about treatment. We need to reverse that trend.
Our Native community listens to the Native community. There's a connection. But cancer has been a taboo. We don't know enough about it to know how to talk about it. We have to talk about it and take care of ourselves and take care of each other. We have to love ourselves enough to take care of ourselves.
My brother Al was the oldest, 10 years older. My sister Adra, 6 years older. My sister Vicky, 4 years older. Myself, and my sister Red, Darlene, but we call her Red. These 3 are gone from cancer. I have had cancer. And my mother died of cervical cancer.
Sarah's story is just one story. There's literally thousands of those stories right now in Alaska.
I lost my husband to cancer. And from the time that he found out he had a tumor to the time he passed was 1 month and 3 weeks. So my goal is to be an advocate that will help our people and help them understand that this is real and that there are ways to prevent it. We have screening, and that they shouldn't miss their screening opportunities because they may be saving their life. I want to get that awareness out there because a lot of people don't really know too much, you know, and they rely on the healthcare system, which sometimes fails you.
I think there are layers and layers to this. We need to be multifaceted in how we approach it. So education is important, but it's not the only thing. There needs to be a greater understanding of the plight and that more needs to be done. In 2017, I lost my mom to colorectal cancer. My mom had been seeing her provider for years, talking about pain in her stomach. And to this day, I really wish I could get an answer as to why she didn't get a colonoscopy. Because had she gotten screened and gotten that colonoscopy when she first started exhibiting signs, likely she'd still be here today. Some of her last words to me were, "Don't let me have gone through this for nothing." When she said that to me, she knew that it would light a fire for me. And a few months later, I was approached by the American Cancer Society asking if I would serve on a new board that they were developing. So as the American Cancer Society here in Alaska, we're trying to bring awareness to the things that are going on, trying to partner with entities that can make a difference, and trying to do things to meet the unmet need that's there.
It's a true humanitarian way to strive to save lives. And we save them by educating people. There's hope there.
It seems very simplistic, but everything really hinges on the front end. Getting people tested, prevention. And if we can address that, I think that's where we really make that impact.
What I want everybody to know is to listen to your body. It doesn't matter if cancer doesn't run in your family. If you feel that something is not right, get checked out.
In 2010, that's when I had my first mammogram, and that's when I found out I had breast cancer. I took a slow drive home from the doctor's office and debated on, one, what was I gonna do? You know, it was pretty scary just for myself as an individual. And then two, how do I get my daughter through this? I don't want her afraid, and I was afraid. So I had to show her the strength. But she became my beacon. The 50 radiation treatments were probably the most grueling. So back and forth, 140 or so round trip for a literally 10-minute session. So it was a lot of travel, but I was determined. It wasn't the easiest journey, but it was necessary. She got through high school and we learned she was going to start applying for colleges. And then when she got her letter that she'd go to Stanford. Now I'm just waiting for grandchildren. I can't wait for in 10 years or 20 years, whenever she takes next steps in her life, I can't wait to see her family unfold. So it's not we're not in middle school anymore, where I'm afraid I'm not gonna see her when she's 16, or she won't see me. Now I know. We're walking down this path. And we've gotten over quite a few hurdles. Cancer is not going to stand in my way. And I've never let it. It's painful to me to know my friends that I've lost to cancer, and I don't know why I get to sit here today, but I do. So I'm gonna make the best of it.
I don't think a lot of people know about the resources that are out there that can help them. If more awareness can be brought about the American Cancer Society, I think that would benefit a lot of people and help relieve some stress.
I work with our local American Cancer Society folks, and we're constantly chatting over ideas that, you learn from all over the place. It's like, oh, these folks are working on this, like maybe we could do that here. So I think those interactions throughout our country, learning what other tribal communities are doing in the lower 48, just learning from each other. I think that that's the best we can do.
Getting involved, it was really nice to be able to represent the Native American community within the American Cancer Society and bridge that gap. It's my community, my family, the Matchi-Beneshiwish Band of Potawatomi Indians is why I'm doing this. I feel like I was put on this earth to represent my tribe in some way, so I hope that this is it.
And if this video can help one woman, it's worth that.
One of the other great things about the American Cancer Society is the big focus on research that they have. That research has led us to earlier diagnoses and screening recommendations or screening tools or treatments of cancer and different types of cancer.
As we know, even with my story, having HER2, 5 years prior to my diagnosis was terminal. And so the American Cancer Society is paving the way where we're going.
I'm grateful, so grateful for the American Cancer Society helping the Native community, Alaska Native community, American Indian community, really begin to get a better handle on what this is about in terms of cancer, education, early detection, treatment, and the ability for all of us to have it be something that was back there.
I've seen American Cancer Society step into roles and talk about health disparities and talk about prevention. I think what they're doing is helpful and good for all communities, especially smaller communities that are having a hard time speaking for themselves. The American Cancer Society is out in the communities, out in the public, sharing information. Now I need someone to start listening.
The challenge is it's falling upon deaf ears. It's falling upon deaf ears through our legislation, through our government, and responding to these critical needs of our indigenous communities.
This is why I do cancer research, because it has such a community impact. I know that I can go to the American Cancer Society database and I will know exactly what is the incidence of this type of cancer in this population at any given time, because that is work that the American Cancer Society has taken on year after year. We assume that it's already known that healthcare disparities are obvious to everyone, and that is not the case. Have we really understood the genetic diversity of each individual, of each population? What we use as a template to compare a genome, there are areas of the genome that are not represented because the reference genome is a white male. And we have just understood this in the African American population. We haven't even started digging into what happens into all the indigenous populations.
Cancer research for Alaska Natives is virtually non-existent. The dollars for research do not match the critical need.
We're taking a Band-Aid approach to saving lives, and a Band-Aid isn't going to work.
There is a story there that is very evident and accessible that indigenous communities have been made invisible. They're the asterisk on data, the asterisk that's not statistically significant.
I'm on a few state committees, city committees, and one of the subjects I always bring up to people, state level, city level, is when I'm filling out a form, why isn't there a Native American option? Our numbers aren't even tracked. We are here, and our health does matter. Our people matter. We really need to have boxes on forms.
Everyone deserves a fighting chance, and while we're quite different genetically, the one common denominator that we all have is that we all want our voices heard. I think we need to take the conversation outside our echo chambers, because when you unite fronts, then you're much more likely to advance and create change.
If we come from a strength-based perspective, we know it can be done. How do we do this work together? When we work alongside programs and organizations like the American Cancer Society, we can create space for that.
I can say that we are unified in mission to rid the world of cancer. We all want early detection. We all want effective research. We all want these same things. Let's focus on that, and let's let those things bring us together so we can have the outcomes we all really want.
Who wouldn't be proud to partner with the American Cancer Society? What a great mission. No one can argue with that. And now for them to focus on specific population groups, including ours, First Americans, Alaska Natives, I think we can accomplish a lot together.
Natives are courageous people. We face the most unfathomable, but we're also imbued with a teaching of faith that you have to keep hope alive to show the young that all the tomorrows they're blessed with are worth living for.
There's another story there, right? There's the story of strength. There's the story of resilience.
Strong, resilient, resourceful, innovative. You had to have those things in order to survive and thrive. in the environment that we come from, which is some of the harshest environment in the world.
Our faith and our spirituality is going to carry us because our collective ancestors that carried them through hardships that they knew along the way to survive. And we're going to do the same thing.
We're still fighting. We're still fighting to maintain and sustain the stories that have been passed down from generation to generation. We're still fighting for the ways that our Indigenous knowledge should be incorporated into Western institutional frameworks. We're still fighting to be heard. We're still fighting to share with our relatives that we are all related and create this understanding that we need to do this work together.
And we're talking truly about saving lives, right? Help us tell the story. Because I think between efforts through American Cancer Society and others, when the awareness piece is done, when the stories are told, I have to believe that more will be done.